Hello everyone, my name is Dr. Seun. I am a chiropractor and a biomechanist, and I work a lot with injury prevention and rehabilitation. If an athlete is coming from an injury, are they ready to get back into the field of play? Now, this is a double-sided coin that I like to always refer to. On one side of the coin, the athlete might feel like I'm ready to go, or the coaches might feel like I'm ready to go. I need to get out there onto the court, onto the field, onto the track, wherever. And then we do another test after their pre-test where we saw their baselines, and we actually see that they're pretty far from those original baselines, that they aren't actually as ready as they think they are physically. Now maybe mentally they may be ready, which is great, but physically they're at risk for re-injuring themselves if they go back to play too soon. The other side of that coin is you have athletes sometimes who are afraid. They've experienced some type of traumatic event associated with their injury, and subconsciously they're afraid. They're scared to get back onto the field. They're scared to perform their drills. They're scared to give it all they've got. They're afraid of the pain that they feel. Now, when you have instances like that, you can now do another test again with dorsivie. Compare it to that pre-test that was done originally, and you'll be able to see that maybe that athlete is right back where they started, or even better than where they started before. And these objective data points can show the athlete like, hey, although your coaches and your medical staff and your athletic staff are telling you that, hey, you are ready to go, and you don't feel like it, now you can see that you are actually back where you were when you started the season, if not better than where you were. So you can give it a chance, you can go for it. So in this case, we are working smarter and not harder. We aren't subjecting our athletes to unnecessary injuries. We're actually preventing future injuries, because in the assessment, we are identifying where each athlete is using one limb or one side more than the other. So we can address that early. One of the ways that we now take this data is we give it to the coaches, or we give it to the strength and conditioning coaches who control how these athletes are getting stronger by the day. We can also start to recommend things like stretching, like Pilates or Legree, like yoga, like anything that allows them to focus single limb types of exercises on the areas that are showing lower performance. This way, not only are we allowing the athletes to reach their full athletic potential, but we're giving them a fair shot at having a healthy and long career.